You're watching The Wellness Hour, the independent leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have an expert on the topic. In fact, according to Dr. Eckert, he says no more dentures. Nobody should be wearing a loose-fitting denture. Dr. Eckert, welcome to the program.
Randy, thanks for having me.
Now, before we get into today's topic, and I know you brought some photos, for people that don't know Clear Choice, who's the typical patient and what are the different services that you offer, and what's your role there?
Typical patient at Clear Choice is like any patient in any dental office, except we're seeing patients who have lost teeth, one tooth, multiple teeth, perhaps all their teeth. They want a solution. They're tired of wearing dentures or removable teeth. They want something that's going to give them teeth back. We use dental implants to help that be accomplished. We have a team in each of our offices. The team is the oral surgeon, the prosthodontist, that's what I do, I make the teeth, and the dental laboratory that do the technical aspects of...
All right there.
All right there in one building, and all working in a concerted effort to treat that one patient one at a time to get them from start to finish in an expedient way.
Now, is this true that patients can walk in on the day of the procedure with no teeth and walk out with a fixed set of teeth, a full arch of teeth, in the same day?
Absolutely true.
Is that common or rare?
We do it every day.
Really?
We do it every day. We have our surgeons, they're placing implants. I'm there restoring those implants every day.
You guys call it, and I'm paraphrasing, or the third set of teeth. What do you mean by that?
Well, we have a primary set of teeth when we're young. First tooth comes in at about 6 months of age. We lose that primary set of teeth usually by the age of 12 or 13, and the permanent set of teeth come in to replace the primary or baby teeth, if you will. Once we go to the permanent set of teeth, in many instances, patients, for a variety of different reasons, gum disease, tooth decay, accidents, may lose some of their teeth or all of their teeth. And our third set of teeth, we look at the implants as providing the support for a set of teeth that are connected permanently to the implants, which are connected permanently to the jaw. And that combination gives them back something that is very similar to what nature gave them the first time around and the second time around.
Now, when these people leave the same day with teeth, so they walked in without teeth, they leave with teeth, how soon can they eat?
They're going to be eating that same evening.
Really?
Now, they're not going to go home and crack nuts with those teeth that first evening. That would be a little bit unwise. But they can go home and they'll be able to eat a relatively softer diet. But we just had Thanksgiving, and at Thanksgiving dinner, there wasn't anything that was served on our table that couldn't be eaten by a Clear Choice patient who had had their teeth
So they could eat
placed
like
the day before.
turkey or things like that?
Absolutely. Anything that you can cut with a fork. 2 weeks after surgery, they could probably even eat a tender steak. I don't want them eating, one of the ones that's sort of like shoe leather that you get sometimes.
Now, in the process, you're the guy that fits them with the teeth,
Yes.
right? So you get to hear these stories. Do people tell you stories like of what they ate? Is that part of what you have to hear all the time?
Sure. Usually the story is not what they ate, but what they don't eat. They have a whole list of things that they used to enjoy and that they can't enjoy anymore. It's interesting how often at the top of that list is a salad. Think about a salad. It's a very thin piece of fibrous lettuce. It really takes a lot of chewing, and it's not just straight up and down chewing. It takes horizontal chewing. And that horizontal chewing you can't do if you don't have teeth meshing against each other, forming a solid bite. When we do implants, we're able to secure teeth that have that form that allow them to have that solid bite.
So they can eat whatever they want. I mean, when they're all healed up, I mean, they can bite into whatever.
Yep.
Like a carrot with their front teeth?
Sure.
So it doesn't matter.
Sure.
Now, you say that in your area, there might be 300,000 people that have no teeth.
Yes.
If dental implants are so good where you could walk in one day and get a fixed set of teeth, why aren't they all doing it? What's your take?
Well, a lot of these patients haven't seen the dentist because there was no need to see the dentist. They had their teeth removed. They either wore dentures or they stopped wearing dentures entirely and just learned how to toughen up their gums so that they could chew, albeit not very effectively, with their bare gums. These are folks who quite often lost their teeth, and they weren't real happy about losing their teeth. But once they lost their teeth, they considered their problems with teeth done, buried.
So the last thing they want to do is go see you, I guess.
Yeah, they had already gone through that litany of visits that had occurred over the years. You know, sometimes patients would come in, they'd have some cavities, they'd get some fillings. Fillings would lead to sometimes breakage of a tooth, so they break a cusp off. Maybe they need a root canal. Maybe the root canal succeeds. Sometimes it fails. All these things combine, and each time they come in, you know, we have to face it, dentistry is probably not the most comfortable thing that we go through in our lives. No one wakes up on a Tuesday morning and says, you know, it's a beautiful day, I'm going to go have a root canal. When we realize that patients lose their teeth, they probably suffered quite a while before they got to the tooth loss. Now we have an opportunity for them to replace those.
So they
teeth.
just don't know their options because they don't go in
quite
to
frequently.
see a dentist.
Quite frequently.
How old can you be to do this?
There's really no maximum age. I've treated patients up to the age of 95. Well, they were 95 when we placed their implants.
Really? Now, why would they want to do it?
Because they want to eat and chew better. If you think about it, when you're out 95 years of age, you're not out running marathons. You're enjoying food with your spouse, with your children. You want to be able to go out with them to a restaurant and not have to look for the softest food on the menu and find out that the only thing that they can eat that day is pudding. It's embarrassing for them. When they get teeth that are secure and stable, now they can eat anything that they want off of that menu just like they could when they were 20.
And so they're not more likely to fall out if you're 90 years old.
No, implants in elderly patients seem to do, I always use the term mature, implants in my mature patients seem to do just as well as implants in my younger patients.
Now, you believe, or you say that you're transforming people's lives.
Absolutely. These are folks who sometimes have given up on a lot of the social activities that really make life worth living. And we're able to give them an opportunity to regain that social part of life. Smiling, speaking, breathing. All of those are parts of activities that teeth provide for us. And then all the other, the being able to speak clearly, to be able to eat a good meal, those are other benefits for teeth.
When it's all done, do they say, I should have done this years ago? Do you ever hear that?
I've never heard a patient say, I should have put this off for another 5 years. Every day we have patients who will say, you know, I visited somebody about implants a few years ago, but they made it sound so complex. It was going to take 2 years to get it all done, and I just didn't want to devote 2 years of my life to it. And then I came to see you folks. You told me how it could be done in a day. First thing was I didn't believe you.
Now, aren't they skeptical, by the way?
Oh, sure.
Because it does sound gimmicky to me. I mean, obviously
Absolutely.
there's a couple of appointments, but on the day of the procedure, they walk out with a full set of teeth. So that really happens.
It absolutely happens, and we can go through and explain that to them, how it happens. And sometimes they even going into that surgical day, they're skeptical, but at the end of that day, they say, usually it's, I can't believe how good I look. I can't believe I have teeth. This is a miracle.
Is there family in there sometimes? When they're showing them the mirror?
The family is usually in the recovery room. So the patient will walk into the recovery room, and
it's like one of those reveal shows.
I've seen patients sort of collapse in joy.
Wow.
It's remarkable.
But isn't it true, though, that if you've been in dentures, let's say 20 years, 30 years, you don't have enough bone to get this done?
It's not true. We have patients who have heard that, but that's...
Heard that from other doctors?
Heard that from other doctors, other dentists. And usually it's because the dentist just doesn't know how to creatively place the implants, how to make use of the available bone. They don't have the three-dimensional imaging that we have that show me where implants can go. If you don't know where you can put implants, it's going to be very hard to just arbitrarily pick a few positions. So then they'll tell the patients that the procedure is not possible, or that it's only possible if they go through aggressive grafting procedures that the patient would certainly like to avoid if they can. And because we have the imaging, we have the three-dimensional pictures that we can look at of the patient, it tells us where we have the opportunities to place implants, and then we just have to take advantage of those opportunities.
So how soon, if somebody goes to you, right, and let's say they still have teeth, but they're just hanging on, right? How soon can you tell them whether they're candidates or not?
On that first day, we know whether they have bone or not, and we're able to show them where we're able to place the implant, so they know right away when they do that initial consultation.
Do you ever get excited, like you hear their hard luck story, and in your mind you go, boy, this is going to be good?
It's sort of a fun experience when you can look a patient in the eye and say, Mrs. Smith, we can do this. We can do this right away. And they look at you and they give you this sign of relief. I've seen patients grasp their chest, and I always hope that they're not having a heart attack, because that's a different job.
Yeah. So they're really surprised and they're skeptical. Yeah. Even the day of I think you told me this on the phone, where they go, so I'm really going to go home with teeth.
Yeah.
So pain, by the way, let's talk about pain for a moment. I guess they're sedated?
The procedure, they should be comfortable throughout. When the procedure is done, imagine if you were hanging a picture on the wall and you were putting a nail into the wall and you hit your thumb, what's the first thing that you do? You grab it and put pressure on it. When we give the patient their teeth at the end of that day, what do those teeth do on the underlying gums? They grab them and put pressure on them. It's a pressure bandage. There are whole theories on pain, and I'm not going to explain those.
Okay.
But when you put pressure on the area, you immediately improve the comfort of the patient. You do that, you use ice, you use pain pills. Mostly the anti-inflammatory pain pills are what the patients need. We'll give patients a prescription for a narcotic which will take their concern with pain and make it go away. But really, the anti-inflammatories do the job for the vast majority of our patients.
But don't let pain, so the patient that's watching this, don't let the fear of pain keep you from doing this.
I would definitely recommend that people not be afraid to do this from that standpoint.
Now, going to you, okay, so you're a specialist. You work with an oral surgeon, the prosthodontist, all under one roof, and the lab, all right there. And there's, I guess, other dentists, any dentist can do this, technically, right? Does it cost more to go to a guy that has experience? I mean, we should also, I haven't bragged about you, but your credentials, I mean, you're one of the most famous prosthodontists in the country. Because of your position at Mayo and things like that. But does it cost more to go to?
It doesn't have to cost more. The important thing is that we get the patient in, look at their situation, and we identify the way to provide the treatment in an economical manner. Once again, the imaging that we have tells us where we can place implants. We're avoiding a lot of the other procedures that add to the cost. We know how to do it without adding those extra costs.
At the top of the show, I said that you said no more dentures. Is that the future of dentistry, where all dentures in the future will be attached to something?
I would suggest to you that every tooth replacement in the next 10 to 15 years is going to be attached to something other than attaching it to gums.
We're going to take a quick break. And when we come back, a little bit more about the process, what a patient can expect on day one. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I had a gum disease. My gums started to recede. It all went awry when the teeth started to loosen. I couldn't smile anymore. My daughter got married. I stood in the background for the wedding pictures. I needed something more. With Clear Choice, I could go in and come out the same day with a beautiful smile.
What we were able to do for her is remove the bad teeth and place the dental implants. And one day, she was walking out the door with new teeth.
At Clear Choice, we're bringing hope to thousands right here in the Twin Cities area who suffer from missing or failing teeth.
The big advantage that we have at Clear Choice is that we have the lab, the prosthodontist, and the oral surgeons under one roof.
Call today for your free consultation. We'll walk you through the entire procedure, including costs.
And now I go to weddings, I get in their pictures because I look good, I feel good.
At Clear Choice, you're about to discover what you've been missing all these years. Call Clear Choice today. There's a way to get a life-changing new smile at one place in one day. The Clear Choice way.
I had an accident and lost a great portion of my upper jaw. I lost 6 teeth. There was infection.
We're doing amazing transformations. We have expertise that you might not find anywhere else, all in one location.
In just one day, under one roof, Clear Choice can give you a long-term solution so you can get back your smile and your confidence.
When they handed me the mirror, I was overwhelmed with unspeakable joy. To restore to me not only the use of my teeth, but my smile and my zest for life. It was just amazing that I got all of that accomplished in one day.
Not just another dental procedure, this is a true life changer. The Clear Choice way. Call today to schedule your free consultation.
You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My guest says, no more dentures. Okay, so Clear Choice. You're doing this every single day.
Yes.
You see it every day. People come in without teeth, they leave with teeth. And that's not an exaggeration.
Absolutely no exaggeration.
Now, what if somebody has bad gums, okay? Can they still do this? I mean, it's bleeding gums, loose teeth.
Yes.
Will the implants work in their case? Are
Yes,
their
they
gums
will.
healthy enough, I guess is my question.
Well, when you have bad gum disease or bone loss, when you take out the teeth, you take out the cause of the disease, and that's the bacteria that's on the teeth. So we use the bone that is healthy, that was beyond where the tips of the roots of those natural teeth were, and that's where we place the implants. And so we're not using the infected area, we're working around the infected area and getting our implants into healthy bone.
Now, do people, I think you told me this too, you said people hold on to their teeth too long. That means a lot of your patients that come to you, especially the men, right? They put everything off. They come in when they just literally can't eat or they're in too much pain.
Indeed,
Is that right?
that happens. A risk of doing that is that you can make the entire process a little bit more difficult. So it is a matter of timing out your treatment, doing the implants at the appropriate time when it still is a very easy, straightforward process. But even in a patient who waits too long, we're still able to identify those specific locations where the implants need to go.
Now, what about the smile itself? Do they look real? Because I feel like I could spot a denture walking down the street.
You can probably spot most dentures walking down the street. I don't think that you would spot our dentures walking down the street because we're not giving the patients dentures anymore. We're giving them teeth on a solid foundation. We can study their smile line, the size of their face, their complexion, the color of their skin, the color of their eyes. Sometimes I feel like an interior decorator as I'm going through the different swatches and explanations. But after doing that, we're able to customize the treatment for the patient so that the teeth look like nature put them there.
Okay, you brought some photos of samples of Clear Choice patients. Mm-hmm. Let's take a look.
Yeah. So here's a patient who would be very typical of the sort of patient that we see at Clear Choice. Patient who has a few missing teeth in the smile line, a few other defective teeth outside of those. And at the end of the examination, it becomes clear that they don't have enough good teeth that we can just simply fill in spaces. We need to remove and start over. So that would be a patient that we would plan.
And these people come to you because they don't want dentures. Is that
Absolutely.
right? Because that's where they're headed, but they don't want it. Okay.
It's very rare that you see a patient come in and say, you know, I have 10 friends, they all wear dentures and they're just happy as clams. You know, that just doesn't happen.
Yeah.
They will tell us, my mother wore a denture, my father wore a denture. I thought it was inevitable that I was going to wear a denture, and I'm so happy that there's a way that you can make something for me that's not a denture, that has permanent teeth, that I don't have to think of that way. So here would be how this patient was treated to give her a set of permanent teeth. It's not a denture. Now it's teeth. Patients don't come to us for implants. They come to us for the replacement teeth, and that's what we're able to give them. The implant is just a foundation for it. So this is not my patient, but it is a patient who was treated at Clear Choice. Take a look at the difference in the size and shape of the teeth from the initial photograph to the one after we treated this patient with implant-supported teeth. The contour of the teeth, the way that the teeth mimic the smile of the lower lip as she smiles. Just look at how much more vitality there is in her expression. Take a look at her eyes. You know, she's probably taken 10 years off of her age.
Yeah.
Here's another patient that we treated at Clear Choice, not in my office, but this is another patient with missing teeth, broken teeth, spaces. He's never been real happy with his smile just because what nature gave him wasn't exactly what he wanted. After a day with us,
there's a big smile.
Here's what we were able to do with his situation. And we have a whole stack of these. Patients who have broken teeth, missing teeth, gum disease. One after another, we're able to just give them new teeth that will be there for a lifetime. Here's just another patient. Example after example. In one day, her life is transformed. Imagine how much of a change took place in that patient.
Pretty smile.
It's incredible. It's
so
incredible.
You like this, by the way. It's like you're showing baby pictures here.
You know, it's interesting, speaking of babies. If you look at a newborn, you can tell when they're smiling.
Yeah.
If you look at a 80-year-old, they can give you a smile, but if they don't have teeth to be in that frame, their smile doesn't look like that newborn. You can't see the joy. That's the thing that the newborn can communicate. The 80-year-old, the 90-year-old, the 40-year-old who's missing all their teeth, they can't convey it anymore. They're like this gentleman. He's trying to smile, but do you really think that he's smiling?
And many of these patients, I hear that you have to kind of, boy, that's a great result on this. It does change their appearance just with teeth. But you have to force people to smile on the befores, right?
Sometimes it's our hardest job. It's easier to replace all their teeth than it is to get them to give us that smile on that first visit many times.
So there are people walking around that aren't smiling and just because they don't like their teeth.
Absolutely. Absolutely. Not only are they not smiling, or if they smile, they give you one of those looks.
Can you spot it all the time when you're out and about?
I think we can all spot it.
Tell me this, because we literally have like 2 minutes left. But options for denture wearers with Clear Choice, and correct me if I'm wrong, you as a company like to give people a fixed set of teeth, a permanent set of teeth that don't come in and out. But there's snap in, snap out. That's very common. I hear about it even on my show, where they snap in, snap out. You don't like that, and why?
Well, there are a couple reasons. The snap-in dentures still have movement. The snap-in denture is still a denture. Patient still has to remove it. It still compresses on the bone behind where the implants are, so that causes bone loss. The patient still has to watch what they're eating. They can still get food underneath the prosthesis. And when they get food underneath that snap-in denture, they're biting down on the denture harder than they were when they had dentures because they've got a little bit more stability. But now when they squash on a seed in a small piece of fruit, that will now compress into the gums and irritate them all the more.
And they don't last very long, sometimes? Or there's a lot of adjustments or maintenance?
Because the bone is going to shrink, the denture will rock on the two snaps or on the two implants. And as it rocks, now many times those dentures will break. Plus the parts that cause the connection, which is like a little trailer hitch or an O-ring, many times those will wear out, so the patient will have to be in every so often
So
to replace.
patients should ask for a fixed set of teeth that doesn't come in and out.
Patients should ask for what nature gives them, and there's nothing in the body that comes in and out except for teeth.
Okay, good. Well, yeah, I want to thank you for coming to the show. We're completely out of time. Final message to a person, either, they're hanging on to their teeth, they know they don't want a denture, or the denture wear, and they're watching this and maybe they're skeptical. It's hard for them to believe. What do you say to them?
Come in and talk to us. We can show them why they don't need to be skeptical. While they're sitting in the lobby, they can talk to other patients who are out there who have gone through this procedure, and they can tell them what they've experienced. The best people to explain how well this works are those folks in our lobby, because they've gone through it, they know what it's like, and it's amazing how I feel like I should be going out and giving everybody a pie at the end of the day to celebrate the fact that they've coached my next generation of patients because of their experiences.
Okay, good. I want to thank you for coming in. Very,
thank
very
you.
good. Very interesting. And they can go to your website if they want to know more, make an appointment.
Absolutely.
See you there. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.
I had a gum disease. My gums started to recede. It all went awry when the teeth started to loosen. I couldn't smile anymore. My daughter got married. I stood in the background for the wedding pictures. I needed something more. With Clear Choice, I could go in and come out the same day with a beautiful smile.
What we were able to do for her is remove the bad teeth and place the dental implants. And one day, she was walking out the door with new teeth.
At Clear Choice, we're bringing hope to thousands right here in the Twin Cities area who suffer from missing or failing teeth.
The big advantage that we have at Clear Choice is that we have the lab, the prosthodontist, and the oral surgeons under one roof.
Call today for your free consultation. We'll walk you through the entire procedure, including costs.
And now I go to weddings, I get in their pictures because I look good, I feel good.
At Clear Choice, you're about to discover what you've been missing all these years. Call Clear Choice today